4 countries, it doesn't mean somewhere end of the world. It's main our countries: Latvia and Russia, main market, Ukraine, Kazakhstan, at least. Main therapeutic groups will remain the same. Definitely, as I mentioned, this is heart and cardiovascular, anti-cancer, and central nervous system. The let's say weakness of Grindeks, which is quite clear for everyone sitting here, definitely is the dependence on one product, which is mildronate, which some 3-5 years ago concluded about 70% of our annual revenues. So this is the weakness of Grindeks, and we are aware of this. The strategy is to diversify our product portfolio and to decrease dependence on one product. At the moment, we have 10 years product or 10 years pipeline for bringing new products in our product portfolio. And definitely what I mentioned already, this is vertical integration between API business and final dosage forms. It's not a secret that Grindeks has some activities in developing or bringing new original drugs. If we speak about this, then at the moment we have about 5 different molecules which can potentially end up with the final dosage forms, and definitely if we are lucky, then those molecules can be quite successful ones. But if you ask me, do we really believe that we can bring up those 4 molecules to the market, assuming time frame and resources necessary to do this, to perform all the clinical trials, to perform all the preclinical trials, to perform all the registration activities for new drugs? Definitely I will say no, because this is years and millions. So the question is what to do with those patents. Let them die on the shelf, or try to derive some value from those patents. So management of the company basically following model in this respect. We will pick up only one molecule which we will develop to the, let's say, final dosage forms ourselves, investing our own money, company's money, investing our human resources, and we'll make our own activities in all stages of development of original drug. And regarding remaining patents, definitely we will try to follow partnering model, meaning following thing. We will develop those molecules to the extent which we can sell to potential partners interested in those molecules, in those product segments. In this case, this is a question how far we should go with the preclinical trials. This is number 1. And number 2, this is the right choice of the partner in the right markets. In this way, we try to basically share expenses, risk of failure in case of clinical trials, and definitely in this case we will have to share also revenues, markets, and potential profits in the future. Statistics is a nice thing, and basically you can do nothing with this. If you look at the world experience, how successful companies are with new molecules, you most probably notice that not very. If we think about how many failures companies suffer through this process, it's much more often than they experience success. So in this case, we really try to share this risk, and share the risk of losing money through the way of clinical trials and bringing original drugs in the market. So in other words, I would say that third big activity of Grindeks in the nearest future will appear sales, or let's say dealing with intellectual property we have in our portfolio. And this is the story about how successful can we be in the process of selling this intellectual property to potential partners worldwide. We'll see. Marketing strategy, definitely to stabilize our position in the current markets of the final dosage forms. We definitely can think about entering Europe, penetrating Europe with our products, but this is more about fairy tale, frankly speaking. I believe more about, if we're speaking about CIS countries, and increasing our presence and stabilizing in biggest market like Russia, Kazakhstan, Ukraine, Belarus. It's a tough story. There are some other countries which are quite huge in terms of population, which means it's a potential market for us, but rather difficult in terms of culture of doing business there, like Uzbekistan, for example, or Tajikistan, and so on. We will make our activities in Latvia, our home market, definitely. Our results we have right now in Latvia is not acceptable from our point of view, and definitely we can be bigger in our home market. We do think that we have good opportunities in Scandinavia with our products. We have a good story with Zepiklon, which is basically currently occupy about 70% of total Swedish final dosage form market. We will try to do the same success story with other drugs in other countries as well. And China is not, let's say, far away land, and we want to be there. And we make some steps finally to get military aid to China. The one lesson we derived from previous our activities in China is definitely the stuff that China is more developed in terms of registration processes and requirements for clinical trials than we believed before. That's why this process went quite long and quite sophisticated in terms of procedures, and rather expensive in terms of resources. Just to sum up those issues I just mentioned, then we do plan not less than 10% growth in revenues in the coming years, at least 10% growth. This is what we articulated before, and this is what we will try to perform in the future. At least 4 new generics annually in 4 countries simultaneously. The pipeline is, as I mentioned, is created for 10 years, assuming the end of patents, assuming performance of markets. The biggest attention will be paid to development of product portfolio and diversifying product portfolio. We will definitely experience rather moderate activities in CapEx activities. In previous years, we financed heavily into CapEx. Currently, there is no need for us, or at least we do not see any needs in development of such activities. Besides, Europe is full of free capacity for production of any form of final dosage forms. Increase of our sales of existing products in existing markets and entrance in the new markets. We will try and we'll pay huge attention to, let's say, deriving more value from our intellectual property, what we have in our portfolio. Investment into R&D activities will be limited to 10% of net sales. This is the policy which was, let's say, previously articulated by the management, and this is what we will try to keep stable in the current years, because we believe this is the future of the company. And definitely there will be cost-cutting programs implemented, and they are currently implemented, and we review our presence in different countries and the payback from those activities what we have in different countries. Most probably in the nearest future you can hear news about closing some representative offices in some countries, or reshuffling our structure of the company.